Good evening, everyone. Please let me know if you can hear me. Type Y in the chat box if you can hear me and also see the slide. Please use the chat box, and you can also use the emojis on the Zoom toolbar. Perfect. Thank you, Nandita, for confirming. Thank you, Ragini, for confirming. And we'll have certain rules here. The rules are, we'll go ahead with the session at 8 o'clock, another 1 minute to go. And then the session will continue. Dr. Lena will talk about the opportunities in the US. And then you have some questions, you keep the questions ready, and then you can ask the questions at the end of the session. Is that okay? Type okay if that is okay. All right. So perfect. The time is 8 o'clock and we'll begin with the session. Dr. Lena, you are here. Thank you. I can see you. Perfect. Thank you so much.
Everyone.
Thank you. Thank you. I'll stop sharing my screen. Yes. I hope you are visible to all of them. Thank you so much, Dr. Lena, for coming in here. Dr. Lena has been practicing as a nurse for last 30 years in the US. She did her diploma in nursing from Delhi. After about 18 years, she returned to school to get her bachelor's, master's, and doctorate degrees from the US. Her clinical background is neonatal intensive care unit, and she enjoys teaching, and for the past 7 years, she has been an assistant professor at the university teaching BSN programs. She has an experience in the new graduate residency program, training curriculum, and simultations. She currently holds an NICU CNS educator training program position, and she is also a part-time faculty member. So I welcome Dr. Lena, and the dais is all yours. Please let us know how you started this journey and how you got settled in the US, specifically Las Vegas, and let us know how it takes for nurses in India to start their journey in the US.
Absolutely. Thank you so much, Mr. Manoj, for having me. I hope everybody can hear me properly. Yes. I do speak super fast, like any other Indian. So if you can't understand what I'm saying, please do stop, put it in the chat box, and I'll try to, I guess, like Mr. Manoj can monitor the chat box, and then when I will address those questions, maybe like at the end of the session or whatnot. As Mr. Manoj said, my name is Lena Journey. I am originally from Kerala, but lived in Delhi for quite some time, did my nursing diploma from Delhi, and I migrated to US in the early 2000s. When I came, I was like very nervous, didn't know what to expect over here. Nursing is practiced differently in the United States. So it was quite a journey, to come over here. I was married, had 2 kids when I came over here. And started in the NICU. I've been back in India also. I worked at LNJP Hospital, if anybody is familiar with Delhi. It's a government hospital. I worked in the NICU over there. And I'm super passionate about NICU. So when I got a career opportunity to come to US, I wanted to go to a state where I would be able to practice what I was familiar with. Didn't want to move to a country and then start on a new floor, or a unit, so to speak. And Las Vegas was one of the places which offered me that career opportunity. Back in the days, US had that shortage, so they were recruiting international nurses, US, Philippines. These are places where nurses do come to US, and they have that opportunity to advance their careers. And I was one of them. I came actually with a green card. I don't think they do it anymore. You come with the H-1B visa and then convert it. But back in the days, we had the opportunity to come with a green card. And I became a citizen after 5 years. So I've been living here in Vegas for quite some time. My personal background, 2 kids, a grandbaby, brand new, like she's 6 months old. My older son is 28 to 29 years now. He's married and have the kid, and my younger one is 19 and he's in pre-med. He's in college right now. Career-wise, as Mr. Manoj said, my clinical background is absolutely NICU. I am very passionate about that area. And after coming over here, I realized that your career doesn't stop where you actually started. It's just the beginning. US is a land of opportunity. You do get to pick and choose what you want to do. In India, nursing career is very flatlined. You can become a charge nurse, or you can become a manager, maybe, or CNO, maybe, and people don't go for it, right? Like, or you have academia. That's about it, right? But in US, sky is the limit for a nurse. And this is a career which is respected throughout the country. We rank #1 as the most trusted profession here in the United States. So it's an excellent career to come over here, to explore, whatever potential you have, and be the best version of you as a person and as a professional. So I decided that, okay, diploma nursing, I don't know, a lot of people don't even know diploma nursing exists. US still have like a few states which has diploma nursing. It's absolutely like a no-no over here. So people are like, you have a diploma, what does that mean? Is that an ADN? So there's like a lot of questions regarding that. So I said, like, okay, let's try and let me go back to school, because over here you don't stop. Like, you can go to school even when you're 70 years old, 80 years old. It doesn't matter, as long as you can do it. You can go back to school. So I decided to go back to school. I went for my bachelor's first because I'm like, okay, I want my bachelor's degree. Then I'm like, okay, why am I stopping myself over there? Went back to school, did my master's. Now my master's is in education. Then I did bunch of certifications. I have like a number of, like, bunch of alphabets behind my name. Don't try to use it. Then I went back to my doctorate also. That's my terminal degree. I'm like, okay, if there is a terminal degree in nursing, I want to do that. So I recently actually graduated after I turned 50. So
Wow, that's nice.
yeah, after I turned 50, right? My grandbaby was born, so before I graduated. So it's an amazing place to work. It's amazing to expand and explore what is out there as a nurse. Well, after I graduated with my bachelor's, I went to teaching. I was always teaching, but not as a profession, as a career. So I went back to university, and I've been teaching in a BSN program, both online and face-to-face classrooms. I do simulation. I'm an NRP instructor. I am a stable instructor. So I do like a lot of other side gigs, so to speak, but related to nursing. So it's excellent, and I appreciate the opportunity to talk about my story and inspire anybody who want to explore the career path here in US. I can see one of my colleagues, Dr. J, is also on the line.
Hello, Dr. J. You mind coming in here?
I am going to go share my screen, and I'll talk about what nursing is, how nursing is in US, and how you can, what are opportunities is there for you guys when you're coming over here. Let me share my screen.
We'll have a discussion with Dr. J later on after the presentation, if he's still there.
Sure. I hope you can see my screen.
Yes, yes, it's visible. Yes, ma'am.
Okay. So today, like the objectives of our presentation would be the introduction into of nursing programs and nursing careers here in US. What is the process to becoming a nurse in the US and what requirements? So it's a little bit different than what you guys are very used to in India. Uh, to be a nurse, to continue as a nurse, there are certain requirements you have to absolutely meet in order to do that. And what are the specialty areas in nursing? As I said, nursing is actually practiced very different than any other country. You have a lot more autonomy here in US. You are your patient advocate. So when I say autonomy, that means that you have the opportunity to make those decisions. You're partnered in healthcare settings. You are partnered in the decision making of your patients. So, you do have a lot of responsibility. So if you are assigned a patient, you are responsible, completely responsible for that patient. There are other ancillary staff which is involved in the care, but ultimately it is the nurse's responsibility. So anything and everything which happens with your patient, you are answerable to it. You want to make sure the orders which your doctors write is appropriate. That is correct. The medications which you're giving, that's appropriate dose. That's correct medication for what your patient is in here for. Your therapies which you're doing, your procedures which you're doing for your patients, they are all appropriate. And if it's not, it's your responsibility to question that. So in that sense, nursing is different here in the United States. You are also responsible for your professional growth, which means that you are responsible for keeping up to date, right? Like no matter what department you're working, or which field you're working, you're still responsible for making sure that your certifications are up to date, making sure that you're reading articles and literature and keeping up with the current practices. So that's your responsibility. As I said, accountability is huge here. You cannot say, oh yeah, my doctor wrote that, that's why I did that. Ultimately, you are the one who is going to be giving the medications. Ultimately, you are the one who is performing that task which your physician has written. So if you do not know, then it's your responsibility to go and verify that, or seek advice, or go higher up on your chain of command, and make sure that that's appropriate. Whatever that you're doing is appropriate. That also goes with the documentation. In India, I don't know, when I was practicing, documentation was like, oh, okay, eh, you can miss here or there, but over here, no, documentation is very important. And if you don't do it properly, then it means that you didn't do it. Any conversation which you have, any assessment which you're doing, any procedures which you're doing, you want to make sure that you are documenting it appropriately. Another important aspect, or another fascinating aspect about nursing here in US, is that it's constantly evolving. You're never stagnant, so you have to be, policies and procedures are constantly updated. Treatment practices are constantly updated and evolving. So you have to be able to change, so to speak. Change is the only constant. I always tell my students this too, like change is the only constant which you have in this profession. So you really have like make sure that um, you know what you're doing, so and why the new practices, why are we doing this, you do have to make sure that you understand those things too. So that's another one. healthcare is considered to be a high reliability organization. So I don't know how many of you are familiar with HROs. HROs, like if you look at automobile industry is one, your aeronautical is another one. So they work as a team. They constantly go back and make changes. So healthcare industry is also considered to be one of them, HRO. So you really have to make sure that everybody works in tune, works in sync to the betterment of your patient. So every time you are doing something, you're making a change, you're constantly doing it in order to have better outcomes for your patients. Your ultimate goal is for the better outcome for your patient. So that's how nursing is, our healthcare industry is seen here in the United States. Um, One other fascinating aspect about nursing here in US is like it's governed by like state regulations. Every state has its own nursing body, and your scope of practice, so to speak, comes from those governing bodies. So your board of nursing dictates what you can do and what you cannot do as a nurse. So it's your responsibility to make sure that you know what is within the scope of your practice. States are different. So as the constitution is like very similar to what India is, like, somewhat similar to what India is, you're the federal or the central government, some of the policies are there, but then the states decides like what kind of regulations they have. And as I said, like nursing bodies are there. Then other regulatory bodies are there, which control or which looks at what your how the industry should work. There are certain standards, certain norms, which these regulatory bodies do dictate, and everybody who works in the healthcare industry needs to know about it. Nurses play a huge role in it. As anywhere else, nurses are the front and center of patient care. We are the advocates, we are the frontliners. Ancillary staff is there, but at the same time, nurses hold the burden of caring and caring for your patient. So these are like certain things which is different from any other country where you will be practicing. So US is unique in that sense. So as we continue, I'll have like move my as we continue our presentation. So process of becoming a nurse in the US. First of all, you will have to like verify your credentials. That means that you have to match your curriculum, however many hours of classroom or what we call the didactic portion, the clinical portion, the simulation portion, this all matches with the standards what US has set. So you have to get your credentials verified. That goes with not just getting a job here in US. Each time you're applying for a higher degree, you will have to go through this process. Each time you are changing states, you will have to go through the process. So it's kind of like a pain, so to speak, to, me here for after 18, 20 years, I still have like to go back and get my credentials verified because my original degree is from India. I have to get my credentials and my transcript verified from India. every single time. So that's the first step. Though there are credentialing bodies, you pay and you can get your credentials, or whichever state board, whichever state you are applying to, they will have a list of credentialing bodies which will verify your transcripts. So the transcripts has to come from your nursing school or your nursing board, so to speak. So that's the first step in it. There are states. The second component to it is getting your CGFNS exam passed. CGFNS also does your credentialing. They do charge more for credential or your credentialing, but that some states do not require you to have the CGFNS exam. CGFNS exam is very similar to the NCLEX or RN board exam, which we write over here. As I said, like there are certain states which doesn't require, you can directly apply to the state and pass your NCLEX exam. English proficiency exam is the second one. So either you have to have IELTS, I believe it's 6.5 for all 4 modules in IELTS, or your TOEFL. So one or the other, you have to make sure that you do have those English proficiency exams passed. Then the third one is your NCLEX. NCLEX is your board exam. You only have to write it for just one time. Even if you're a nurse here in India, you still have to clear your NCLEX exam. I do believe that there are centers there in India. I believe like there's one in Madras for sure, one in Delhi, and I can't confirm whether there's one in Bangalore also. So there were a couple of NCLEX exam centers there in India, or you have to travel over here and write your NCLEX exam. NCLEX exam and CGFN exam, as I mentioned, it's very similar. It's multiple choice questions. So there is like no essay writing or short answers or anything. It's all multiple choice. And what they are looking at when you're writing these exams is, are you a safe and competent nurse? Every time they ask any question, so most of the time it's like case scenarios, and they'll ask you to pick an answer. What is the best answer? Probably like when you look at those answers are like all same, or like they are all correct. From all the correct answers, you have to pick what is the best one, what is the first one. So they're always looking at safety and competency. So these exams are designed in that way. You minimum questions for your NCLEX is 75, and the max number of questions that we should go to is 250. It takes a lot of practicing. When I actually wrote my NCLEX exam, I probably like did like 3,000 practice questions before I went and wrote my exam. So you really do have to like practice, because you do have the questions are worded differently, so you will need to learn to look at those questions and answer it. There are coaching centers in India. I do like they prepare you for CGFNS exam and NCLEX exam. If you want to study on your own, Kaplan has really good textbooks. Mosby's has really good textbooks. Elsevier has really good textbooks. So there are NCLEX exam preparation books which you can buy. I do believe Amazon has like tons of them. You really do have to practice before you sit for your exam. Once you clear your exam, you get a temporary license, which is valid for 6 months. And you do have to like do your backgrounds, you do have to do your fingerprinting, drug testing. So these are all part of becoming a nurse or like working as a healthcare professional in the United States. And also on top of passing your NCLEX exam, you have to meet your state requirements. If your board of nursing states that, oh, you absolutely have to have this subject, or like, these many credits. We call here in the US, we call it credits. The number of hours or for didactic you have will translate into a credit, so how many credits of didactic you have, if your state has a requirement, you do have to like meet that also. And also your hospital. So your hospital may say, oh, okay, I do want to we want you to have an NRP certification or ACLS. So like these are all like certifications which you have to do in order to practice on a certain unit. So you have to meet all those requirements before you can become a nurse. I'm not going to go talk about the visa processing. That's like a completely different, topic per se, which I don't think like I'm an a subject matter expert on those issues, so I will not speak to it, like how to get to get to the visa processing and all. That's not my matter, expertise. So we will skip that portion. But as to be, once you have that visa processing and all that, this is the requirements to become a nurse in the US. So I do see there like a lot of chats there. Are we addressing the chats now, or are we addressing it later?
I'm taking care of that chats, ma'am. Don't worry about
okay.
it. Yeah.
Okay, perfect.
Thank you. Yeah, thank you.
Thank you. All right. So before I go into the specialties of in US, I want to just mention like what are the different types of nursing programs in US. As I said, like I am a diploma nurse. Like my original degree is a diploma nursing. In the US, there is very few colleges which offer diploma nursing, because diploma nursing is basically based on clinicals. So your didactic portion is there, but you're heavy on clinicals. Your hands-on portion, which we call, or in India, I would say like you're going into your units and you're working with your patients. So that hands-on portion, that is more in diploma nursing. Here in the US, we do have a shortage of like preceptors and clinical sites and whatnot. So diploma nursing is not practically, possible here in US. So they have gone away from diploma nursing. Back in the days, like in the 20s and 30s, there was like a lot of diploma nursing. That's all what they had. And now as things have evolved, most of it is ADN and on so forth. But we do have like CNA or PCT. So these are like in India, I would say these are like your, I don't want to say your ayabais or like your ward boys, but yeah, I guess like that's them, because they do help in like patient care and whatnot, right? I think. At least that's somewhat in my head, I think. But CNAs are like certified nurse assistants or patient care technicians. So depending on which state you're practicing. So I have license in Nevada, like so in Las Vegas. I live in Las Vegas, or used to live in Las Vegas. I moved to California. I have license in California and I have license in Arizona. So different states have different terminologies, but CNAs or PCTs, we call them, patient care technician. They can work in acute care, settings, and I'll talk about what acute care and what subacute care settings are, so you guys will have like a better understanding of how the hospital systems work here in US too. So CNAs and PCTs, they cannot like practice independently. They're kind of like your assistants. You can ask them to go get your vital signs, so your like heart rate, blood pressure, and whatnot. You can ask them to, or like you can ask them to like clean up your patient, give a bedpan to your patient, or assist the patient to, we call the ADLs, right? Like activities, or like a brush your teeth, or comb your hair, or dress them up, or help them to take shower or whatnot. Your CNAs or PCTs can't do that, but ultimately, like, they are working under you. So you as a nurse, you as an RN, you are responsible for making sure that like they understand what your patient population is, and whether they are performing it correctly or not. So definitely, you do have the responsibility also, but they can work in acute care or any kind of settings they can work. Next is your LPN or LVN. Not all states have this. LPN is your licensed practical nurse or licensed vocational nurse. It's a shorter program. So your CNA PCT programs are certifications, like 6 months to 8 months. That's what their school requirements. You have to have 12th grade, and then you can go into this shorter certification courses. LPNs and LVNs, they are like 1 year, 12 months to 14 months, that most programs run that long. They do have like anatomy and physiology. They do get a little bit of that. And then they do get a little bit of clinical experience. They can perform a lot of things which nurses or RNs we call, or like, nurses. If you are a nurse, you want to make sure that you're an RN. So people who are coming from India who have a diploma or a BSN or an MSN, when they're coming over, you become an RN register. Once you pass your NCLEX exam, you're an RN over here. So even though LPNs and LVNs will be considered nurses, they are not RNs, So that's a major difference between the two. They clear the NCLEX exam also. They also have to clear the board exam, but it's a PN exam which they clear. Most acute care facilities will not, they don't employ LPNs or LVNs. LPNs and LVNs mostly work in like long-term facilities, rehabs, doctor's office, so these are like the places normally like LPNs or LVNs work. They do have restrictions, so they cannot like do certain medications, or like drugs we call it, certain medications, NOx push, they cannot do chemo, they cannot do TPN. So there are like certain things which they cannot do for your patients. So the scope of practice is different. Then we do have ADNs, which we call the associate degree in nursing. So your diploma nursing in India will be somewhat equivalent to your ADN programs. BSN is your bachelor's in nursing. That both places are similar. Occasionally, I have seen people from India who are coming with the BSN. Their transcript doesn't match for doesn't meet the criteria to be a BSN over here. So occasionally they have to take like a couple of classes here and there to meet those criteria and maintain that. So to become an ADN and BSN, you do have to clear your NCLEX RN exam. Both LPNs and RNs are governed by your nursing board, your state nursing board. They dictate what you can do and what you cannot do. So it's your responsibility to make sure you know the scope of practice when you are in those, when you're practicing. So US is going away from the ADN programs. ADN is shorter. I don't want to say shorter. Your didactic hours are lesser and your clinical hours are lesser for your ADNs. There are still some people do get into nursing into the ADN programs because it's not as hectic as the BSN programs. So people do get into the ADNs, and that's like the entry point, and then they do like a bridge programs. We do have bridge programs over here, RN to BSN, RN to MSN programs are here. So people do get into ADN for that purpose. So you can start working as an RN and start earning, and then go on and get your higher degrees if you desire to. Hospitals now, most East Coast, like when I say East Coast, is like New York. Most people can relate to like New York, like up there. That's called East Coast, and California would be considered West Coast. So most East Coast hospitals have completely gone away from ADN programs. You do require BSN to get into our practice. So if you are an ADN, they will provide you with educational money in order for you to go and continue with your education. So if you want to work there, your contract will say within 2 years you have to complete BSN, or if you have within 5 years you have to complete BSN. So most places are going away from ADN programs. So that's BSN programs. Traditional BSN programs over here are like 3 years, but you do have accelerated. I teach accelerated programs, so my programs are 14 months to 16 months. In 16 months, you become a BSN. There are entry-level MSN programs also over here. Other practices or other branches of nursing would be nurse practitioners. So nurse practitioners is an advanced degree equivalent to your master's, although now the regulatory boards are mandating that all nurse practitioners also get their doctorate degree, since it's like it's an equivalent to your MSN program. So MSN, you do have various branches of MSN programs. So you have education, leadership, informatics, there's a lot of opportunities for you to do the MSN programs. And as I said, like there's always bridge programs are there when you are coming over here just with a diploma or just with the BSN. You can go from do a bridge program from RN to MSN, RN to DNP, those kinds of programs are there though. Entry-level MSNs are also 16 months, 14 to 16 months. So which means that like you absolutely do not have like even time to breathe. You're eating, living, and breathing nursing. That's all about it, right? So you can't do anything else. You cannot work, or have a side job, in order to complete your school. So that's definitely there. So these are like the programs which you will hear, or which is available to you here in the US. And if you guys have any questions regarding these programs, or like how it works, I'll address it like in the end of the session though.
Yes, ma'am. Perfect. Yes.
Okay. Otherwise, my chain of thought is just going to go that way, and then
yeah, we'll complete the session, ma'am, presentation, and then we'll have the Q&A. Participants they'll ask questions directly with you.
Perfect. All right. So let's continue with this. So different types of healthcare facilities in the US. As I mentioned earlier, like, acute care and subacute care is there. So acute care, when we talk about it, these are our hospitals, like, where you and I normally work is our hospital settings. Then there are research centers. So there are, even though they are hospitals, they are research-based. So Stanford is one of them, right? Like, so they are like very popular or very famous. They have hospitals, they have the university, and I work for the children's side of it. It's called Lucille Packard. So there are research facilities though. Then we have traumas. So trauma centers are also affiliated with, that's your EDs when we call the trauma. Trauma goes from level 1 to level 3. Level 1 trauma center will take anything and everything under the sun. So the most critical patients goes to the level 1 trauma center. NICU is opposite way. If any of you have NICU experience, NICU works the opposite way. Level 1 is like the newborn, like the normal, and level 4 is your highest. So it's the opposite way when you talk about trauma and NICU. NICU is the only place which is like reverse. Level of care is higher with the higher number, and the trauma is the opposite way. So each state doesn't have like not all hospitals are level 1 trauma centers. So if you're working in a trauma center, you have to make sure most of those trauma centers do prefer nurses who are BSNs. So majority of your facilities will employ BSN nurses. So then you do have freestanding ER. So it's just ED or emergency care which they provide. They don't provide anything else. So they'll just take you in, do your care, and then you can they get transferred to a hospital or like other centers. So they don't keep you there. We do have day surgery centers also over here. So most of your procedures which doesn't require hospitalization or like long-term hospitalization. Sorry, I cannot speak anymore. They do it in day surgery centers. So patients will come in the morning, you prep them, you get them ready for the OR, and they go in the evening. So they do not stay in those facilities longer than 24 hours. So 23 is the cutoff, and then they have to go home. So daycare surgery centers, they are considered to be acute care. Psych facilities are there too. So psych hospitals, which subacute care is like skilled nursing, or we call the SNF. So your patients who require long-term therapy, they say, for example, your ICU patients are ventured and trached and have are staying, requiring hospitalization for like a longer period of time. They may move them, like your chronic patients may get moved into SNF or skilled nursing facilities. So your LPNs, a lot of your LPNs, LVNs do work in your skilled nursing facility. Then the rehab places are there. Long-term facilities do take intubated patients, patients with central lines, patients who absolutely cannot go home on any kind of medical facilities. So these are like your long-term facilities. Then you do work in the doctor's office. So doctor's office, RNs typically don't work in the doctor's office. They are like normally like your LPNs or LBNs or MAs. We have like in other categories like medical assistants. They also work in the doctor's office. So it's just a gist of like what your acute and subacute care looks like. What are your requirements? So I think like I covered this in the previous slides too, but each state has its own regulatory requirements. Continuing education hours. So that's another thing which is like different than India, practicing in India. Once you get your nursing license, you're not required to like mandated to have X amount of education hours in order to keep your nursing license. So most states, your nursing license is for 2 years. So every 2 years, you will have to renew your license. Although there are states which will give you your license for 5 years if you're practicing. So which means that you can have your nursing license and not practice, so that you can stay dormant, but actively if you're practicing 2 years to 5 years, that's normally what state requirements. So every 2 years, I have to apply, or like the reminder comes that, okay, your license is expiring in, normally it expires in your birth month. So my birthday is in March. So my license every 2 years expires in March, for at least for Nevada, or Las Vegas. California is every 3 years. So Nevada, it's $200 to renew your license. You have to come up with it. You have to have a clean record, so to speak, which means that nobody has reported you to the board. You have no violations, and you have completed your continuing education hours. Each state has its own requirement. So for Las Vegas, I'm going to give Vegas as an example. Vegas requires 30 hours, 30. So it can be anything. So if your board audits you, should be able to produce your certificates that, yes, I have completed this many hours of education. So that's what I said, like your professional development, that responsibility is yours, right? So if you are not doing it, you may lose your license. Once you lose your license, it's very hard to reinstate your license. So that's something which people, like, forget, and can get in trouble also. So definitely, like, one has to be responsible for that. Then there are like mandatory certifications. So any healthcare provider to work, whether it's your like whether it's a nurse or a doctor or a pharmacist or PT or OT, or even the housekeeping, like your people who take your trash and clean your floor, they also require BLS. BLS is your basic life support. So you should be able to resuscitate any patient. So BLS is an absolute requirement for anybody, any healthcare professional who is stepping inside of a facility, who is going to provide care for patients in any capacity, right? Like your housekeeping or like your cleaning person doesn't do like direct patient care, but they are in the vicinity. So if your patient is going down, they are required, should know how to perform a CPR. So BLS is your CPR, cardiopulmonary resuscitation for your patients. ACLS is your like advanced cardiac life support. So people who work in the what you call your ICU settings, right? So they do require, so adults requires ACLS. If you're working on the peds floor, pediatric floor, or peds ICU, you require PALS. I generally work with babies, so neonatal resuscitation program. These are all your certifications which you are required to get when in order for you to work in the United States. So BLS is an absolute must. Rest of it, depending on which department you're working. So your higher acuity patients, where they are like your ICUs, your traumas, your burns, your PICUs, NICUs, they all require these additional certifications. And that's your requirement to keep, to work here. Board can also ask you to get fingerprinted. Most nursing boards will ask you to get fingerprinted every 10 years. So your background has to be cleared. You have to have your TB clearance every year in order for you to work. You have to have all your immunizations up to date in order for you to work. So every year you have to get like flu shots. Now like COVID vaccine is there, like, so everybody has to be COVID vaccinated if it's against your religion and if you don't believe in vaccinations. So there have been instances where like nurses and physicians and, like whatnot, everybody was let go because you are working in a profession, in an industry where you are providing the services, and if you don't take that, you're like, okay, you can go. So those are like some of the requirements you absolutely have to meet. I don't know whether I mentioned drug testing also. When you're hired, you always do get drug tested. There are places which randomly do drug tests also. If somebody reports you, then you get drug tested too. So those backgrounds also come in in place because of that. So your fingerprinting will run your background, which means that you don't have any criminal records, you don't have any felonies, you don't have any arrest or reports in your background, to in order for you to practice. That's a safety issue, right? So that's one of the things which you absolutely have to have in order for you to practice as an RN here in the United States. Now, coming to our specialties, right? So this is
Ma'am, your screen got freezed. Participant, please confirm if you can hear Dr. Lena. You can put in the chat box. Ma'am, your screen got freezed for some time. We lost you in between.
Okay, can you hear me now?
Yes, now we can hear you.
Okay. Oh, it says my internet connection is unstable.
Yeah.
Probably it's like the day is coming up, right? Like, kid, my younger one is probably on his video game already. I'm sitting downstairs actually, like, so there's no disturbance.
Okay, all
Up
right.
there, you can see my screen now, correct?
Yes, ma'am, we can.
Okay, all right, perfect. As I was saying, like med-surg is your general unit, like we call it medical surgical unit, which are pretty much like all your patients are there, like anything and everything walks in. So that's why we do have any of these specialty areas. We do have certification programs that goes for med-surg. Med-surg didn't have a certification program, but you can have a med-surg certification. So you're like specialized in all kinds of medical surgical patients. ICU, so normally like medical ICU is there, surgical ICU is there, trauma ICU is there, neuro, so cardiac ICU is there, CBIC we call. So these are all subspecialties of your ICUs. You can get certifications. They are like shorter certifications. So you become like this super special nurse for these specialty areas. IMC is your intermediate care. So IMC has different, it's a step down from your ICU. So they're like in between your med-surg and your ICU. So those kind of patients, okay, they can be vented, they can be on drips and whatnot, but they are higher acuity. When I say higher acuity, that means that they require more assistance and more treatment than your regular medical surgical patient, and lesser than your ICU patient. So that's it. ED or ER. So ED or ER, nurses normally do not like. So one thing about United States is like, if you're on a floor, you are on that. You are the expert on that floor. You don't get to go to ICS. You have to have the skill set, so to speak, in order to go and function in any of the other departments or the higher acuity areas, which in order for you to practice. So they have to give you orientations. They have to make sure that you do have those skill sets in order to perform those type of care for your patients. Trauma is there. So trauma, absolutely, like you have to be a trauma certified nurse in order for it to work in trauma, because it's very action packed, like you have to pick up and run on the fly, right? So you're like constantly moving and constantly evaluating, constantly reevaluating, doing your critical thinking. So there's like a lot of action and a lot of thought process going behind these areas. ED, trauma, there. Telemetry is another one. So here patients, if they require constant cardiopulmonary monitoring, so to speak, your patients are put on with leads and attached to a box, and those boxes are connected to a central monitoring system where a tech or a nurse who can read EKGs will be sitting and monitoring all these screen simultaneously and will call on the floor and say, hey, your patient has this VTAC going, or your patient is going into arrest, or you do have a skip beat, or you have a block or whatnot, So telemetry is another floor. People do specialize in, and so you're very good with reading EKG rhythms. You are really good with picking up cardiac defects. So telemetry is another one. Bones is a super specialty area. Not everybody can work in bones. Women's services, chemo. Chemo is so not all med surg can have chemo patients, but you cannot, as a regular nurse, you cannot do chemotherapy here. You have to be a chemo certified nurse in order for you to do chemo. So most nurses or most facilities will have a chemo unit per se. So any type of chemo they are doing, they will come in, stay in the hospital for 1 or 2 days, get their chemo, and then go home. So they have different protocols for their unit. So women's services includes labor and delivery, postpartum, antepartum, and some high risk, so that's women's services. People who are passionate about OBGYN, they are the ones who will go in there. You do have RNC OB, as that's like a certification which you can take, and you can become like the special nurse for women's services, or like OB GYN, for sure. Sorry, my phone was going off. So women's services is there. Peds and PICU, pretty much everybody knows it's pediatrics. So pediatrics has its own pediatric general floor, which is your med surg for pediatric patients. So pediatric patients come over here, starts at day 28 of life. So before day 28, they are considered to be neonates. Mr. Manoj, let me know like if I'm like taking too much time though, okay? So somebody can talk all that.
It's perfectly fine, ma'am. Go on. It's
Okay.
very informative. Very, very informative.
Okay. So peds patients can range from as a 1-month-old baby to all the way up to 18. So you have like a wider range of patient population when you're dealing with peds. Peds ICU is your critical care area for pediatric patients. A lot of places who do chemo also do peds chemo. So you do have certification in chemo pediatrics in order for you to practice on those floors. So NICU is, again, neonatal intensive care unit, where I work, or like I used to work, like I don't do bedside anymore, but that's where my niche is. So we take care of most of our babies are premature or extreme prematures, which we call babies who are ranging from 22 weeks gestational age. So normal your gestation age is 40 weeks, and babies who are born at 22 weeks. So, like what, 5 months, 6 months, or whatever pregnancy and onwards, with multiple defects and whatnot, right? So it goes from level 1, 2, 3, 4. 4 is your highest level of care for most places, where they perform like ECMO and, all other like complex procedures, so to speak. So that's NICU. NICU also have certification. We call it RNC, NIC, and IC. So it's a certification. So most of these certifications are like shorter, like you do it on your own time. You take an exam, and depending on which certification you're taking, anywhere from between 2 years to 5 years. So you will have to go and redo these exams. So say you are a med-surg certified nurse, you have to go back and take this exam in 2 years, which means that you have to specifically study for what that particular area is specializing in. So which means that you have to keep current, so NIC, RNC NIC is one of them. I have that certification. So every 2 years I have to go back, pay money, right? Like $300, $400, I think like it's now $400. You have to study for the exam. So it's very specific to neonatal area. Like anything and everything which is happening in my world, I have to be updated and I have to do that. So that's how I become like the super special nurse. So, like I'm more marketable that way. If somebody is coming for me, you're like, okay, you have RNC, so that's how you market yourself too. So I always encourage people who are coming over here, make sure that you're going into those specialty, like they are shorter certifications which you can, and you're more marketable in that way. So you definitely have like bariatrics is huge. I don't know, like US has like a huge obesity problem. So we do have like bariatrics. People are very fascinated with that, and it's very special care which you have to like do for these patients. Your surgeries and diet and counseling. So you do a lot of that. Geriatrics is there. Psych is there. So psych nurses are super special. Like huge demand for psych nurses here, not just in hospital setting as tele. Informatics is there. So if you're good with computers and if you like numbers and if you like to play around with things, informatics is there. So that's another branch of nursing which you can absolutely go and just do teaching and or like do all the programming, because all of our documentation charting system is on computer. We don't have like very few paper charting is there. Everything is online or like on the computer. So informatics is there. Case management is another one. I do not believe India has anything which is similar to case management. Case management is like that area of nursing which and any of these specialties, when I'm talking about, these all have certifications. You have to have your basic RN degree license, and then you take these certifications. So case management, they will look at the appropriateness of the care which you're providing. So they work with the insurance companies, they work with the physicians and the nurses to make sure that your patient is getting the appropriate care and within the time frame. So you cannot say, okay, I'm going to keep this patient for like 10 days just because I feel like, right? You cannot do that. So your case manager will look at those charts, look at the documentation, talk to the physicians. Why is this patient getting this treatment? Why is this patient not getting transferred to this facility? Why is this patient not getting upgraded to an ICU? So they are the ones kind of like a bridge between insurance and then the hospital setting. So that's what case management. Research nursing is there. So absolutely based on most of the care. Stanford is a research facility. So we do a lot of researchers there. You have nurses who are solely into that. So you pick a topic and you work with a group of physicians and nurses and you do the research. So you do the data collection and implementation and all that stuff. Quality is there. So quality, nurses who work in the quality department, they look at all the policies, all the procedures, and make sure that they're up to date and meets the standards of the regulatory bodies. So, one example I will give is how we do patient identification for giving medication, right? So we do, like in the US, most places do have the scanning system. So you scan your patient's ID band and you scan the medication and it will tell you like, okay, is it appropriate or not, right? So quality will look at, say you gave a wrong medication to a wrong patient, and quality will look at and say, okay, why did that happen, right? So they will come in and say, what is the flow? Where is the flaw in the workforce, right? Like, or your workflow, what happened, what missing pieces there, and then they try to mitigate that gap or like bridge that gap and like re-education. So quality looks at all your measures, quality measures, they look at that. So that's something nurses do. Infection prevention is not another one. Hospitals, long-term facilities, rehabs, they all have at least like, so your regulation based on like how many how many bedded your facility is, you have to have X amount of infection prevention nurse. So they like really look at like your processes, your policies, your how you perform certain things, and to make sure that there is no infection control issue in our unit. So that's another. You do have like in infection prevention, you have master's degree also, so you can super specialize in that. Nurse navigators are another career opportunity. People who are interested. So what nurse navigators do is they will. If you want to transfer a patient from one facility to the other, nurse navigators will look at, okay, is that an appropriate transfer? Is this facility just dumping that patient to this one because the patient doesn't have insurance, or it's a low paying insurance, or they don't have that, so sometimes those things happen. So nurse navigator's job is to make sure that it's an appropriate transfer. So they kind of like becomes the middleman to make sure that, okay, that patient is appropriate to come. You have the facilities, you have the physicians, you have the resources to treat that patient for whatever reason they are coming, and within a time frame, and then they go back. So that's nurse navigator job. It's kind of like an office, so to speak, like, so your quality research, case management, nurse navigator, IP or infection prevention, these are like kind of like office jobs. Rest everything, which when we talked about, like from your med search to like psych, they are all bedside patient involvement, right? So you're like caring for the patient at the bedside or in the facility. Rest everything is kind of like your desk jobs, so to speak. You have like some interaction with your patients, but not a lot of hands-on, so that's risk management is there. So risk management, if there is any kind of incident happening, like my previous example, your medication error happened. So risk management will come in and look at that. Okay, what happened? So they will do the investigation. They will mitigate that investigation. So they control the risk. So in here in the United States, if you have a mishap, like for example, your medication error, if it happens, you have to do a reporting system is there. Reporting system is not punitive, but it is to find the root causes and eliminate those root causes, so either it's a human error, or it's a system flaw, or it's a process flaw, or it's an equipment failure, whatever that is. Risk management get involved always when there is like high, there's like anytime there's a patient harm happens. Data analysis is there, so that a lot of times it goes with research nursing, but hospitals do pull their metrics, so how they are doing compared to if it's a freestanding facility. Say for example, Stanford is a freestanding, it's own entity, like, so we collect our own data and then we compare it with other facilities with similar background, and then we compare it with the nation too. So like to see where you are. So data analysis is there. A lot of nurses to work. These are like not positions where there will be like hundreds of opportunities for you, but each facility, depending on how they are doing, you do have like a couple of opportunities, like in the facilities. So nurse educators, that's another one. So each unit now typically will have like one nurse educator. That's like a requirement, right? So they are the ones who will come in and say, okay, this is the policies, these are the changes. So they do like ongoing training. So that's a requirement. Like, okay, if a regulatory body is coming, they will say, okay, what kind of education are you providing to your nurses in order for them to perform their job? So nurse educators comes in. So that's my job now. I am a nurse educator and I'm a clinical nurse specialist, which means that I look at products. Like, okay, say for example, a new needle is coming in, and I want my nurses to use it. So it's my responsibility to look at read my data about it, look at other facilities who are using it. What are their metrics? Is it important, or is it also financially also, is it feasible for me to introduce this new product into my unit? Will that be beneficial for my nurses and my patient population? So that's where your nurse educator and clinical nurse specialist comes in. So a lot of research going on with them. Each unit should at least have like one nurse educator and one CNS. So mine is a combined role. So I look at both processes. So I educate nurses. So new nurses who are coming in, orientation for them, how long the orientation should be, following with them, making sure that their skills are matching to the standards of our unit. So that's how that role, nurse educator and clinical nurse specialist role works. Lactation consultant is another one. A lot of people are like, so that goes with your women's services too. Lactation consultant, IBCLC is another. A lot of nurses do take that certification and become lactation consultant. It's a very, very unique concept coming from this Indian subcontinent, because we are raised to breastfeed, babies naturally, right? But in the Western world, that is not the concept which everybody like can grasp. So you do have like a lot of women who are coming, even if they are like have had like children before, they still need support. And lactation consultants do a lot with mothers whose babies are like in NICU or PICU, so those moms know they can breastfeed. So my 22-weeker is not going to breastfeed. That mom needs pumping and, so a lot of support. So that's another area which you can explore, to say, so to speak, people who are passionate about breastfeeding and, breast milk and all that stuff, they can do that. Telehealth nurse is another one, which is huge now. A huge, upcoming branch of nursing is telehealth nursing. So you consult, so patients can call into you and you look at their sign and symptoms, you diagnose them, and you say like, okay, this is what we can, and give them a, or like they can call in for a medication. Okay, I'm taking this medication. What should I do? So telenursing is there too. School nurse is another one. So every school does have like a school nurse. The benefit of being a school nurse is that you work the school, it's not a year-round 24/7 job. So you work just for that school time, and you get like vacation if you have like kids and whatnot. You get off during your school vacation time. So, but it's very, I don't know, like I'm not, you do have like, have to have like not certification, but you'd have to go through a different background process to be a school nurse though. And you have to keep that certification as like, it's like your license, so to speak, like your school nurse license. And you have to, I have a school nurse. I never practiced, but I have a school nurse license. At one point, I thought like I will go in there, and then I'm like, okay, it's too boring for me. So I just like came back. But practically, like, treat children. A lot of kids do take medication. So they will come and like deposit in with the school nurse, and you are like insulin or like asthma medication or whatnot, employee health nurse is another one, which normally like depending on how big your facility is, you will have at least like one employee health nurse who is responsible for tracking all your immunizations for all the nurses who are working, or you have like a work-related injury, you will be contacting this employee health nurse, so they are the ones who keep track of all that stuff. Wound care nursing is another one. So if you are very interested in like your wound care, and that's a super specialty. Like I do have like kudos to those people. I cannot stand wound. My stomach takes churning when I see a wound. So I don't like, that's not something which I ever will do. But there are like a lot of people who are like into wound care, and that's a specialty. So you can practice also. You can be a wound care nurse, not just for the facilities, but if you provide those services, you can advertise and you can go to patients' houses and then perform the wound care nursing. The public health nursing is another one. So they work for normally for like states or counties, and you are involved with a lot of your public policy making, so make sure that like all your policies are in place, and you're involved with like public health, for so to speak. So a huge demand since COVID hit, so the policies and protocols was changing like overnight. Like everything was changing, like every week there's a new policy, every week there's something changing, so that they were like in big demand, and then they're still in big demand. Community nursing is another one, like very similar to what your public health nursing is. And I think like my other see, specialties never end, right? PIC or vascular nurse. So if you're really good at putting IVs, you can become a PIC nurse. I'm a PIC certified nurse. I only do babies. I have tried, or like I've trained in adults, but I don't like big people. That's just not my thing. Once you start talking back, I'm like, okay, no, you cannot be anywhere near me. That's just me. But PIC and vascular nurses, so that's a certification. You can work in hospitals. A lot of hospitals do have vascular teams, so to speak. So they only specialize in putting IVs or central lines. So PIC lines is like your percutaneous central line, introduce central line. So you can do that depending on like what state you're practicing. There are other central lines which you can place. So those are like lines which you will place for patients who require long-term therapies, like your chemo patients, or your cardiac patients, your transplant patients, so they are like ones who require long-term therapy, and you can do that. So that's another super specialty. People do run their own, like they can start their own business and do these services too, where you charge for the product and then you charge for your time. That's how that PIC ones. Interventional radiology nurse is also there. So these are like IR, if you're going into like the radiology department and they're doing like contrast and doing those studies, so the IR is there. Scrub nurse or OR nurse. So if you're working in the operation room theater or operation room, there are two types of nurses in the OR. So one is your scrub nurse who scrubs and stands with the physician and then helps with that process. And the other one is your circulating nurse. So scrub nurses are like, they do get paid more. It's a certification which you have to take. Not all nurses in the OR scrub. So that's another one. Cosmetology is another one. Like, a lot of clinics, like cosmetology places do hire nurses to give Botox injections and do like, I don't know, like facials, or so cosmetology is also like, RNs can work in those places too. IV therapy nurses, as I mentioned, like your chemo patients or your patients with GI problems, so they had like surgery and they have to be on like TPN or like, your IV fluid therapy for a longer period of time. Nurses can go into their houses and do IV. So like a lot of pharmacies do hire these IV therapy nurses. There are places where you can go to patients. So people will get like vitamin IV bags or whatnot, so that's also a thing. So you can be that. Home health nurse. So home health nursing is where your patients do require monitoring on and off. So they don't need to be in the hospital, but a nurse will go into your patient's house and they will check up on you. Say, for example, like my mom is diabetic. So if she is all by herself and she cannot take her insulin on time, there are facilities, there are nurses who work within the home health department or home health agencies. They'll come to my house, they'll give my mom insulin, they'll check the blood sugar and make sure that she's okay. So I'm just giving an example as my mom, like, having diabetes, but it can be for anything, wound care is one of them. So they may have like bed sores or, pressure ulcers, which we call, and you can go and check up on them, or like they require blood pressure monitoring, or whatnot. So home health is there. Forensic nursing is there too. Your counties, or like your what is it, like the coroner's office, or your post, where they do the postmortems, and so forensic nursing is there. You can get involved with that. There's a lot of places who do auditing for chart audits. Chart audits is, as I said, like everything is documentation, right? Like normally, like nurses will document everything which they are doing. Nurses can go and look at those charts and so I'm a NICU nurse. I know what documentation should happen in the NICU. So like it's normally like your specialized areas. That's what you will be auditing, those specialized areas though. So you can go in and tear apart that chart and say, okay, was everything done properly? Say for example, there is a case, like there is a litigation, for so to speak. So somebody sued you, saying that, okay, the hospital didn't do the proper, proper procedures, or like the treatment was not appropriate or whatnot. So these auditing nurses can go and look at the chart, tear it apart, and then say, okay, I am looking at all this with, like, they go and look at with like a microscope, to find something which is missing, or something which is wrong. So that's there too. Not a lot of, but that is a career opportunity which you have. Legal nursing is another one. A lot of law firms says this litigation, so legal nursing is there. That is also a certification which you can take. And mostly like insurances will hire legal nurses. Law firms will hire legal nurses. So your job is to make sure that your client, whoever you're representing, whether it's the facility, or whether it's the patient you're representing, you are looking into their interests. So that's another one. Now coming to academia, you can become like faculty. I'm a full-time faculty, or I was a full-time faculty, and now I'm doing part-time faculty. So you can do faculty, you can teach. That can be online, hybrid, face-to-face. So I do both, so by both online, hybrid, and face-to-face. So I do all of that. To be an online instructor, you have to take the certification for a certified online instructor. So it's a different way of teaching for sure, and adults learning, right? Clinical instructors are there. So if you don't like standing in front of a classroom and speaking, like giving lecture, you can become a clinical instructor, which means that when the students are going into the hospitals for their clinical experience, you are their instructor. So you are their bedside, working with your students, and the nurses who you're whichever floor you are going to, so you can work with them, teach them, and be a resource for your students. You can be curriculum developers if you're really interested in that. They do look at so the most of the curriculum developers are nurses. They come from their subject, like, or their expertise. So I'm a NICU nurse. I don't like NICU is like a very niche, like very narrow path. So it's like a subspecialty, right? Like it's not a specialty nurse, it is a subspecialty. So not in like a lot of curriculum is there based on NICU. So I do curriculum development, but it's for like adult population. I teach adults med-surg and whatnot. So I do that. Exam writers are there. So if you are, so all these board exams, the NCLEX exams, there are career paths where if you're into academia teaching, you can go in that direction. So they write these questions, so exam writers are there. That's another opportunity. Simulation specialists are there. These are like mostly in academic settings, or they can be in like facilities too. So when we are doing orientation for new nurses, we can put like simulation. So simulation in itself is a subspecialty also, which you can take like, I don't want to say like it's certifications, but you do have like, the more you do it, the more you become better at it. You do have resources for it here, I do not believe that there is a certification for simulation. I could be absolutely wrong also. I really do not know. I have not looked into it. I do simulation. That was part of my teaching job. So I do a lot of simulations too, for my nursing students and for my nurses. You know, that's one way to look at. So people do like who do simulation. So they put, so you have to put your case scenario together. You have to build the curriculum for the simulations. That's like part of being a simulation specialist. So you have like, okay, this is my patient and came in at this time, and these are the vital signs, these are the medications. Now what you do as a nurse, you know, so you have to put the whole entire, it's kind of like putting a plate together. So that's so to speak. Regulatory bodies are there. So those are, as I said, like, you know, state is there, GCO. There's like a lot of regulatory bodies. You can work for them too as a nurse. So they are the ones who will say, dictate and come in and say, okay, your, say, this is my hospital, and you know, these are the things which you need to know, do. And when they do the inspection, a lot of nurses are there in there, so they will come and look at what your process is and, you know, whatnot. So they will be, that is there. You can work for the board. So nursing board is another one. So most of uh, your 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 I want to say like the members and, you know, people who are the regulatory people, they are like all nurses. So you can work for the board also. The NLN and ANA are like your academic and nursing associations. You can work from them too. So a lot of your processes and policies also comes from their recommendations. So it's a lot of research, but you do have like a lot of career opportunities in these areas. Medical equipment is another one. So every, like, you do have like, you know, your monitors, your all your equipments which you use in the medical facility. Nurses do have a career opportunity if you like traveling, say, so to speak, right? Like you can work for these medical companies as a nurse, and you can go as a rep, teach nurses or physicians or like whoever is going to use that equipment. You have that opportunity too. So it's wide, right? Like sky is the limit for a nurse in US, so to speak, though. Yeah. I think like this might be my last slide. Last slide. So I'll talk about it, like what kind of nursing schedules you got. So you have like full-time and part-time. Normally if you're a full-time employee, nurses work to most places work 12-hour shifts. You work 3 12-hour shifts. It just, what is it? 36 hours a week. Like, I do have to do my math. 36 hours a week or 72 hours every pay period. So we get paid every 2 hours. Normally it is an hourly based salaried. It's not a salaried position like which you are very used to in India. In US, most of the nursing positions are hourly based. So what you make per hour, right? As a new grad, you may be making, depending on what, every state has its own like wages. So California pays high, like a higher wage because they have like higher taxes. Cost of living is like houses cost more, gas costs more, like, you know, so that cost of living is way much more higher in certain places. You will get paid accordingly. So your full time is normally 3 12-hour shifts in a week. So you have 4 days free for yourself. Okay. So a lot of nurses do work second jobs too. So it's not uncommon for you to work 2 jobs. A lot of people who have family obligations can work 2 full-time jobs. So you only have like 1 day off in a week. So you're constantly working. There are some of the departments have 8-hour shifts also, like that flexibility. ED is one of them, OR is one of them, but majority, I want to say like 90% of it is 12-hour shifts. So full-time and part-time. Full-time, the benefits, full-time is benefited position. So normally in the United States, your job, your insurance, health insurance is tied to your job. You have to have a job in order for you to have health insurance. So that's like a major change. You cannot survive here without a health insurance. I'm sorry, right? Like, that's one major thing in US is like your healthcare is super expensive, super costly. You cannot afford to go and buy your own medication. You cannot buy things without a doctor's prescription per se. right? So my mom is visiting from India. She broke her insulin pen. I'm giving you an example. And I like started panicking. That pen is not here. It's a European model. So it's not here in US. And I cannot purchase the same thing here. She doesn't have a doctor here. And I just wanted to purchase just an insulin syringe. I cannot purchase an insulin syringe without a prescription. So that's how bad it is, right? So I had to like go around and like find my way, take her to the emergency department and get a prescription from there in order for me just to buy a syringe and needle. So your work is tied to your insurance. So most people will work full time, but you do have that opportunity to pick up extra shifts or work second jobs. Most nurses do work second jobs here. That's how you make the money also, right? Like you do like, part-timers, some places do give it. So part-times you have your commitment would be to work 2 days instead of 3 days. Most places will give you insurance also. Other is to work travel nursing. So travel nursing is that you can travel to any state, pick up like a 13-week assignment, 12-week assignment, or 13-week assignment. You stay there, they will give you like housing and whatnot, so you make a lot of money. Right now, since COVID hit, travel nursing is huge. Most people have like quit like their full-time and part-time jobs and started doing travel. It's ton of money in there, but you have to be really good at what you do. You, as a travel nurse, you're expected to, you get 1 day of orientation, you're supposed to hit the floor and run, so that's what travel nursing is. A lot, you have to have your license in the state which you're going to travel. That's the thing. Since getting license can be very tricky here, especially for nurses like us who are coming from a different country, because we have to get all those credentialing done. So we can be very limited unless we have a compact. So US is going through this compact license. Not all states are on board of it. There are 23 states which is in the compact license. So you only have to have like one license and you can practice in those 23 states. More states we have 50 states here, so most states are joining. Unfortunately, California and Nevada is not a state where there's compact license. You have to have a base, right? Like, so I have houses in California and Nevada, so my home base is there. I have an Arizona license, but I don't have a house there. I don't have a residency there. You have to be a resident in order for you to qualify for being a compact nurse. So a lot of people will move to a state which is compact, get a license there, and then you can travel to all this, so that's an opportunity. If you don't have kids, or your kids, my kids are grown up, they don't need me now, right? Constantly, I'm not there, right? Like they're like on their own. So I have the opportunity and liberty to travel across and then do, what I like to do. Agency nursing is there. So if you don't like to travel and you want to say, I am retired and I want to just work like 1 day a week, or my husband makes ton of money and I don't need to, but I like to keep my license and I want to work, you can go to an agency and they will give you. So they will say, okay, this hospital requires a shift here. Can you do that? And you can go and do one shift and then get your money. So is the contract. Per diem positions are also there. They are like kind of like temporary employees, right? Like, so you have commitment 3 days a month, or things like that, and you can work. You don't get any benefits, but you have to have home base. They don't pay you for traveling or whatnot. The agency and travel nursing also provides, so they will pay for you do get allowances for lodging, food, travel, on top of your base pay. On top of your base pay. And that's how, so your other your housing and your travel, that's where you make the money, because that's like non-taxable. Like, in India, you do your taxing at the end, but here in US your taxes are taken out of your paycheck. Every paycheck you pay taxes. That's how you say. Other career opportunity, other places where you can work is here as a consultant. So you can go into a hospital and be a consultant for, your finances are like, or in a mess. Let me come and you. These are the places where you can make make those corrections and do, or I'm putting up a new unit, say to so to speak, right? Like, I'm putting up a new ICU. You can become a consultant and then give your expertise. Okay, this is like what your criteria for your ICU should be. This, the beds should be this big, and the spaces should be this big, and this unit should have like blah blah blah. So and that's another one. Research facilities and academic institutions also hire consultants, so they will come in and say, okay, your curriculum is, and that's why your students are failing or dropping or whatnot, and you can do that too. So these are like all the places where you can work and expand your career. And I think that is it. Like, oh my God, like I talked for I don't know how long.
Ma'am, you spoke for 1.5 hours. Almost, yeah. That was nice. Excellent. So much of information, actually.
I'm sorry. Yeah, I know. This is information packed. Yes.
Thank you. Thank you so much, ma'am. Thank you. It was such a detailed information, and I thought you had only few slides. I thought it'll be a very short presentation, but the way you actually detailed the whole, slides and, options, it was really nice. And I'm sure this was like a step by step, guide for any, nurse who's planning to migrate to US. And your expert tips are obviously invaluable, and they will definitely be helpful for all of us. Thank you so much, ma'am, and for this powerful packed session. And now participants will take up some questions. So, ma'am, you can stop sharing the screen.
Sure.
If you have any questions, please do raise your virtual hand, and I'll unmute you. You can ask the question directly to ma'am. You can thank ma'am for this wonderful presentation. And obviously, this recording will be available, so you can watch a number of times and keep learning, because there's this in such a short time, learning so much of information is, practically impossible. It's not possible.
Absolutely. This is like,
Yeah.
I do agree that like there's a lot of information for
Lot of
sure.
information.
It's
And
like, whoa, it's went over.
yeah, you've distilled so much of your experience, like 30 years of experience in just 1.5 hours. It's like incredible. Yes. Excellent. So thank you, ma'am. Ragini has raised her hand, so I'll just unmute her. Ragini, if you want to switch on your video, you can switch on your video as well, and then you can ask the question.
Good evening, sir. Good evening, ma'am.
Good evening, ma'am.
Hi, good evening.
It's a good morning for Dr.
It's good morning for me, actually. The sun is
early morning.
Okay, ma'am. Very good morning to you, ma'am. Nice to meet you, ma'am, in this
Very
session.
nice
It was very useful for everyone, ma'am.
Sure.
Hi, ma'am.
Hi.
Ma'am, I am having one doubt regarding you told certain certificate course regarding area and specialties, ma'am.
Yes.
Whether it is like 6 months or 1 year diploma course, or whether it is, you told no ma'am, 2 years once, as we are going to be renewal our registration, no. For example, in our Karnataka, we are going Karnataka Nursing Council registration, like that. Every 2 years once we have to go for attending exams, that particular specialty.
Exactly. So certifications, your nursing license, you have to renew every 2 years or every 3 years, whatever your state requirement is. That's separate. Certifications which you hold, once you take that exam, it's not forever, because practices do change, correct? So every 2 years or every 3 years, depending on what kind of certification you have, these are shorter courses. And most of the time, you don't have to go anywhere. It's online. You do it on your own time. You study, you pay for your exam, and then you write your exam. So if you are not current, then your certification is of no use, right? So that's why they have mandated that you do take these exams on a regular basis, which means that you're going back and studying on your own. So these are not like things which you have to go to a college or whatnot. These are all online courses which you can take. But before you sit for your very first exam, you have to meet X amount of criteria. Say, for example, for NICU, you have to have minimum 2 years experience in the NICU in order for you to sit for the RNC NIC exam. And you have to renew it every 2 years to keep up the certifications. Did I answer your question, Ragini?
Yes, ma'am.
Okay.
And one more thing, ma'am.
Yes.
Actually, in our Karnataka and all, we used to work in all the wards. For example, you told medical ward, pediatric ward,
Yes.
even in ortho ward, like that. In all the wards, every month they're going to be changed in even shift also, ma'am. But
Yes.
in US
No,
and
in
all,
US it's different. Yeah, in US it's different. So if you're a med surg nurse, your skill is just to work in the med surg field. You cannot come into a NICU and work on a baby. You cannot go into pediatrics and work on a pediatric patient. That is not your expertise. That's how nursing is practiced. That's a major change. Like normally, like in India, we are like nurses, right? Like everybody is a nurse. Everybody can go anywhere and work. That's not how nursing is practiced here. And if I am day shift, so I work from 6:30 to 7, so 12 and a half, that 30-minute lunch is also included in my time. So 7 to 7:30 or 6 to 6:30, whatever the time is. If I am day shift, I only work days. I am not going to work nights. Right?
Okay.
If I am a night shift person, I only work nights. So that's you don't unless you're picking up an extra shift for another for another shift, because things are done a little bit differently for both day shift, and that's why you have to have orientation also for the other shift, because whatever the day shift people are doing, your night shift may not be doing it. So you hi Jay.
Hello,
So
Dr. J.
yeah. So Ragini, so you do work in your shift and in your department.
uh, okay, ma'am. And one more thing, ma'am.
Float pool. So sometimes that is dictated by the unions. We do have like unions also here, like most hospitals do have unions. So if union can also dictate, say I am a NICU nurse, I can go to postpartum and just work on babies. Right, so that's that float. So whichever your float is, you can do that. On the other hand, there are float nurses also. That's also one thing, right? So if you are like a master of all trades, so to speak, right?
For
I'm that
example,
of
ma'am.
all trades, jack of none, right? So if you're have worked in med surg, if you have worked in surgical department, if you have worked in peds, and you have all this experience, which means that you can go and work in all these departments, right? So you can become a float pool nurse, which gives you that opportunity to go and practice on all other departments. But traditionally, if you are on one floor, you are on that floor.
And one more thing, ma'am.
Yes.
Madam, you said you're a CNS, means clinical nurse specialist and nurse educator. And
Yes.
you're also a school health nurse. You've done that course.
In a school health nurse, I got the certification. I never practiced it.
Ma'am, what is the use if you're doing that multiple course, you're working in same area?
That is just, so I'm one of those people who are like very fascinated with education and, like exploring new things. That's, like I'm a nurse from India, so I don't have that career opportunity in India. So here I like, my opportunities are like endless. So I can go and do all that stuff. So I just keep on doing it. That's it.
See, you are an explorer.
Yeah, practically, yes.
Excellent, ma'am. Thank you. Thank you,
Okay,
Ragini,
ma'am.
for asking
Thank you
this
so
question.
much, ma'am. Thank you,
Thank
sir.
you.
Thank you.
Thank you. Thank you. So learning never stops here, right? Thank you.
Yes.
Dr. J, welcome.
Hello, Manoj.
How are
Hi,
you?
Lena.
Hi,
How are you doing today?
I'm doing very well. How are you?
I'm very good, very good. It's a fantastic presentation. I think
you.
a ton of information within 90 minutes. I'm sure it'll be useful to the audience. And I want to thank you for, accepting the invitation on
It's a
behalf of
pleasure.
Manoj,
Yeah, it's a
educating some
pleasure.
of the nursing practitioners. Lena
Yes.
is a great nurse. I met
Thank
Lena
you.
in neonatal unit, something like, 20 years ago. And she will be my go-to nurse. If I have any questions, regarding a neonate. Then only I'll speak to the doctor to know the clinical status of the patient. And she is kind of a person, like you said, he wants to explore all kinds of things in nursing practitioner. And I would say, although the physicians are the captain of the ship, and she is the nurse who runs the ship, actually, the healthcare ship. So congratulations, after such a long time, I had the opportunity to see you and talk to you. And,
I know. Thank you
very
so much for the kind words. I really appreciate it.
Yeah,
Just
you've been introduced to the Indian audience, and I'm sure you have many more opportunities through Manoj. Thank you so much.
Absolutely. Thank you.
Thank you, Dr. J, for that wonderful note about Dr. Lena. And I was not aware, nurses and pharmacists can work that closely. And this is something,
Absolutely. And so that's one beauty about like working in the United States. It's like you never work in a silo, so to speak. So you're always collaborating with each other. Say, for example, like, me and Dr. J, we work together. So if we have a baby and we'll put our heads together and say, okay, what can we do? How can we like change this? Like I'll come to him and then say, okay, you can't give me all these medications. I don't have a line. Like, what can you do to get me to what I want, right? So we work together. We'll go back and forth, negotiate things, and just come up with a plan. Because ultimately, his job and my job is to make sure that our patients are safe and our patients, it's in the best interest of our patients, So you do really work very closely with other departments, and pharmacy is, from a critical care standpoint, pharmacy is very crucial to what we do, right? So a lot of medications happening. And so we do have to work collaboratively with each other. You can never work by yourself, So that's being an advocate. That's his job, that's my job, right? So everybody is becoming an advocate for your patient.
Absolutely. Wonderful.
It's a teamwork.
Yeah, teamwork.
Teamwork, yeah. Teamwork leads to dream work, right?
Yeah, absolutely.
Yeah, perfect. Thank you. So participants, any more questions? We have Dr. J, who is a wonderful pharmacist, and we have Dr. Lena, who is a great nurse and great educator. So we learned a lot of things from her today. Yeah, so we have some, Sarika, you can unmute and ask.
Hello, sir. Hello, ma'am.
Yes, Sarika.
Hi, Sarika.
First of all, I would like to congratulate you, ma'am. It was very informative and valuable.
Thank you.
Yes, ma'am. I have a question. I would like to ask, what will be the procedure of getting job in a particular area of nurses for Indian, or any particular procedure that beginners has to take a step to get a job in the US? What will be the procedures?
So there are a lot of agencies. Like when I came through an agency. So there are recruiting agencies. I'm not the subject matter expert for like how to go about it, but there are a lot of like recruiting agencies that would be your starting point to go and explore, like if they are recruiting nurses now in US, I know for sure. So you may want to go and talk to them. That's a lot of preparation too. It took me about like a year and a half to get here. Once I did my CGFNS exam, I did like a little bit of coaching for my CGFNS. I did my LTS. Then I had to wait. The paperwork is like, climbing Mount Everest is probably like easier than coming to United States. I have to say that, not discouraging anybody, but you have to be patient to go through the tedious process of this paperwork. That's immigration takes a long time to clear to coming. It's not like going anywhere else in the world. US has a very rigorous immigration process. So getting to like an agency probably is your starting. There are a lot of agencies which will pay for all your paperwork, and they get a commission from like once they recruit you, or like once the hospital accepts you. So that would be probably like a starting point though.
Ma'am, any
Yeah.
ways to find out, the credible institutions or organizations which do these services?
Yes, the ones which still does is it's mostly like in South India, GlobeMed, GLOBEMED.
Globe
GlobeMed
Med.
is one. Yeah,
Globe
GlobeMed
Med.
is one. It's a very reliable organization. They have like a lot of institutions, so they train, they coach, they do your paperwork, and they do bring nurses too. So they do like IELTS coaching and all that. So that's one. I'll I'll inquire about like I have friends who came from other agencies also, so I'll inquire about it and then I can get back to
Yeah,
you.
please, ma'am. If you could just provide a couple of lists for us,
Sure.
then maybe I can pass on to all the participants, and it will definitely helpful because there are a lot
Sure.
of fake agencies also, which.
Oh, absolutely, absolutely, yeah,
That's the
yeah,
reason.
absolutely.
So
Yeah.
thank you, Sarika, for asking that
Thank you,
question.
ma'am. Thank you, sir. Thank you, ma'am.
Thank you, thank you. So thank you so much. And any more questions, please raise your hand. We'll just be staying for another 2 minutes. So it's already late for Dr. Lena. Early morning for her,
No,
weekend
that's
for
all
her.
right.
Yeah, perfect. So any questions, guys, let me know and we'll close the session if you don't have any more questions. So I'll collect some resources from you, ma'am, and then I'll pass on to all of them. So I don't see any more questions. Ma'am, thank you so much for your time. And Dr. J, thank you so much for, okay, we have one. Okay, last question for the day. Vasant, you can ask the question. Vasant, you can unmute and ask.
Yes, sir. Very good morning, sir. Very good morning, ma'am.
Hi, Vasant. Good morning.
First of all, I would like to say thank you for giving this opportunity for asking question in front of you.
No,
Thank you so much, ma'am. Ma'am, as a student, I would like to know about, is this necessary to qualify all these exam, whatever you said before, such as NCLEX and IELTS?
To come to US?
Yes, ma'am, of course.
Yes, yes. So IELTS is absolutely, English proficiency test is absolutely necessary for you to come anywhere. CGFNS is depending on which state you want to go, right? So if you want coming to California, if you're coming to Nevada, if you're going to New York, doesn't require CGFNS, but NCLEX is absolutely necessary. In order for you to practice, you have to clear the board exam. That's it. You cannot practice without clearing it. And it's a rigorous exam. It takes time to prepare for it. It takes a lot of time from you, a lot of commitment from you in order for you to clear the exam. Though you can either clear NCLEX in India. I always suggest, I have had friends who come over here and then didn't clear the exam, and then they have to out of pocket. You have cannot work. So you are going to spend a lot of money to pay for your rent and pay for your food and whatnot, right? So I always would suggest, if you have an opportunity to clear the exam in India, please do. I cleared my exam in India and before I came. So I was absolutely fine to start my job as soon as I could, so that would be my recommendation for sure.
Okay, ma'am. Thank you, ma'am. Thank you. Thank you, sir.
You're welcome.
Perfect. Thank you, Vasant, for asking that question. And that was the last question for the day. And the best way is to prepare beforehand, before even actually you plan to shift to US, and take the most trustworthy agency. They'll definitely help you out. They'll guide you. And of course, we'll also share some resources for you to understand what agency can help you out. So be prepared, prepare well for your exams and be a subject matter expert in whatever subjects you are studying, because that will help you to study, clear off the exams faster. And this will help you to, go abroad faster as well. So thank you so much, Lena ma'am, for your time. And I thank all the participants, for spending a great amount of time with all of us. Thank you, Dr. J, for stepping in and, interacting with us. It was great to have you here. And it is always great to have you here. Thank you for being with us always.
Thank
Yes,
you,
Dr.
Manoj. Thank you, Lena. I'll see you one of these days in California. You're in Palo Alto, right?
Yes, I am.
In the area? Okay.
Yeah.
Now, my daughter lives there in Sunnyvale, so I may be stopping by and one day I'll surprise you.
Oh, yeah, absolutely.
Perfect. So you carry on, Dr. J, and I wish your daughter's marriage goes really well. And thank you so much for spending time with us. Yeah.
Thank you so much. Thank you, guys.
Congratulations,
you.
Jay.
Thank you, Lena. It just took place. I'll send you some pictures.
Oh, perfect. It's perfect. Yeah.
Perfect. So
Thank
you,
you,
Dr.
everybody,
Lena.
for being here, and giving me the opportunity to like talk to you guys and sharing my experience and my expertise. Yeah, I appreciate it.
It was pleasure, ma'am. It was pleasure, Dr. J. Thank you so much. And we'll meet again very soon in another session. Thank you. Have a great day ahead, ma'am. Thank you. And thank you so much, all the participants, for your time. Thank you. Thank you so much. So I'll stop the stream, ma'am, with your permission. Thank you.
Sure.
Thank you.